And welcome back to Holistic Healthline, your direct line to great health. And our guest today is our good friend, Dr. John Peldyak, dentist extraordinaire, former member of the University of Michigan Research Group investigating sugar substitutes. He also worked with prevention programs for Head Start and mobile dentists. Dr. Peldyak is a founding member of the American Association for Oral and Systemic Health and is the author of his books, Sweet, Smart, and Dental Health. And he has a new book about erythritol coming out this year, so that's very exciting. And hey, Dr. Peldyak, welcome back to Holistic Healthline. We had a whole bunch of people today calling in about tooth or gum problems, and you are just the man we want to talk to.
Well, it's great to talk with you again. It's a really great opportunity. I got to say, I love the concept of your program, Holistic Healthline, because we've been thinking more about this over time. Is that how everything really ties together? So when we talk, for instance, our favorite molecule, xylitol, you say, well, that just sounds too good to be true. It does too many good things. How is that even possible? But then you put it in context and you say, well, xylitol is really almost like sugar, but it's just a little different. The biochemists will tell us that it's a little bit smaller molecule, but it's also a non-reactive version of sugar. So if you imagine all the problems that sugar causes, all the downstream problems, and if you had an anti-sugar that could give you the sweetness and flavor of sugar, but without the downstream harmful effects, that would be an amazing product. So, of course, from our perspective, looking at the dental situation and how xylitol can help prevent tooth decay, and now, more recently, gum disease.
So xylitol, I mean, it's any word that begins with the letter X, everybody gets a little leery of, like, that can't be natural because it begins with an X. What is xylitol?
Right, xylitol was first isolated from natural sources in the 1800s and characterized then. But the early work with xylitol was really about metabolism. How does xylitol fit in with our natural metabolism? That we have, our systems generate about a tablespoon's worth of xylitol every day, even if we don't eat any, because it's part of that very important 5-carbon metabolism that we need just a little bit of these 5-carbon sugars to help our systems keep going the right way. The carbon sugars form the energy molecule ATP and also part of our DNA. So you can see how essential that is, but generally in small amounts. So it's considered a rare sugar or not that important because it's only present in small amounts in foods, mostly fruits and vegetables. Also in the woody parts of plants, the structural parts of plants that we don't commonly consume.
And now a lot of people are out there thinking, okay, well, I, used toothpaste with fluoride in it, and my dentist, in the past did fluoride treatments. Now, isn't that going to save my teeth? Why would I need xylitol?
Well, that's interesting because I just attended a lecture of Dr. Robert Lustig. You might be familiar with him. He talks about fructose and all the damage the fructose sugar does. And he looked into a situation with teeth and said that up until shortly after World War II, the cavities in the teeth were considered a sign of developing teeth. And then we came out with fluoride, and fluoride kind of masked the problem for a while because now he says that fluoride has maxed out. We can't get any more out of it. Fluoride can strengthen the resistance of the tooth enamel to acids, but it doesn't really have the full benefit we're looking for with the microbiome. The microbiome is a collection of all the microscopic organisms that live on us, in us, and with us. And I think that's really going to be the future. How do we address the microbiome? How do we get healthy with the microbiome that lives with us? And of course, you talk a lot about the probiotics, and we also have to consider the prebiotics. Feeding the right bacteria, the right materials. So, for instance, regular sugar would be a very harmful substance to our microbiome. It causes all kinds of problems, all kinds of downstream problems. in fact, and metabolic mayhem. And that's something that, of course, Dr. Jansen, you've done research in that area too with diabetes and the effects of too much sugar. And from the dental standpoint, we look at the idea of using sugar too often. As long as you keep putting sugar on the teeth several times a day, you're generating an environment that's going to favor very harmful bacteria, a very harmful microbiome. And the neat thing about xylitol is very much like sugar. It fits in the same receptors, but it's non-reactive. So there's no link-up points on it. The bacteria can't adhere. They can't stick. If they're just floating around, they're not doing any damage. If they form a microbiome or a biofilm, which is a organized community of these bacteria, that can become harmful. The bad bacteria can take over. The biofilm is very resistant, hard to get rid of because it forms a protective slime layer. It's very, very difficult to treat. Antibiotics bounce right off of it. And the neat thing about xylitol is it helps prevent those harmful biofilms from forming in the first place. And if you do have a problem with that, it would help break them up down the line.
And sugar is also related a lot to inflammation of the tissues as well. And gingivitis, there's a strong connection between the tooth decay and gum disease with the inflammation. Can you talk a little bit about that?
Well, that's a big point right now because at first, with xylitol, we focused on preventing tooth decay. Was demonstrated even way back in 1970 in Finland. What they did was take all the sugar out of a normal diet and replace it with xylitol. It's an impossible situation. You can't imagine doing a study like that today. It would just be way too difficult. But they found that the new tooth decay formation almost stopped in the xylitol group, almost no new tooth decay. So if tooth decay progresses and you get an infection from that, that's a cause of inflammation. It's a breaking of the barrier, breaking of our protective barrier. And same thing with gum disease. If you have the breaking of the barrier, the tight barrier against the teeth, then the harmful toxins and the bacteria themselves can get into the bloodstream. And that increases the inflammation because of the immune response to those bacteria being where they're not supposed to be. And this idea of chronic inflammation leading to all sorts of downstream problems has really come to the fore just the last several years, where we're finding that if you can lower your systemic chronic inflammation, chance of increasing your health span, you'll be healthier longer. If you have a chronic inflammation situation, then you're more likely to get all these downstream diseases, including heart disease, arthritis, even Alzheimer's. There's even a connection to inflammatory Alzheimer's disease. So it's extremely important to keep this under control, and we found that one way to do it is using just small amounts of xylitol, using them regularly, and keeping our mouth as healthy as we can, and that's by controlling the oral biofilm and the oral microbiome, right where the gut starts, right in front. Because when you talk about leaky gut, guess what? If you have leaky gums, that's where the problem begins.
And is xylitol safe for everybody? Does it interfere with any medications?
No, xylitol would be perfectly safe to use. It's even it's metabolized even by little babies. Even premature infants can metabolize xylitol. It's safe for all ages. The only warnings about cautions about it is if you use too much xylitol too soon, it acts a lot like dietary fiber. So, if you have too much in your gut and you're not used to it, it does draw moisture to itself, and you can get some gut rumblings from having too much xylitol. So just start with small amounts. We're talking for dental needs, all you need really is a couple of teaspoons, maybe a tablespoon's worth a day, which is very small, and just in divided amounts in divided servings. That's really easy to accomplish. It's easy, and it's so simple. You just take your regular product. If you use toothpaste now, mouthwash, gums, chewing gum, mints, just replace those that you're using with 100% xylitol products, and that will make a decisive difference in having a healthy oral microbiome.
Dr. Peldyak, we're going to take a quick break, and when we get back, I want to talk a little bit more about, these products and what is we're all about having the best quality products for our listeners. So when we get back, I want to talk a little bit more about that. We're going to take a quick break, and our guest today is Dr. John Peldyak, dentist extraordinaire. We'll be back in a moment with Holistic Healthline, your direct line to great health. And welcome back to Holistic Healthline, your direct line to great health. And our guest today, Dr. John Peldyak, the Molinator, the super dentist. He knows it all, and he's connected, and he knows, what are the best ways to help keep our teeth and gums healthy. And Dr. Peldyak, we're very picky about the brands that we recommend to our patients, customers, and listeners. Is there a specific brand of xylitol products that you find would be helpful for dental health?
Right, and I noticed that you do carry the Spry product line.
Absolutely.
Those are the products that I rely on. Spry is the way I like to think of it, because those products were originally developed 20 years ago for the health food trade. So they avoid the more harmful, damaging ingredients. They stick to pure xylitol. They use 100% xylitol as a sweetener in their products, no artificial sweeteners. And it gives you the full amount of xylitol that you need for the full effect. It was found, there was a new paper that was just released this year that said even low doses of xylitol are effective in the early development of the early microbiome, which means infants. That in toddlers, the young ones, as soon as their teeth start coming in, even small amounts of xylitol are effective, but in adults with established microbiome, it might take more xylitol more frequently. So that's why we go to products such as Spry, that's pure xylitol. It has the necessary amounts, and it also has extra ingredients, too, in some of the products, I believe in all the products now, that has a calcium buffer added, so it keeps the pH higher, reduces the acid, and lets the xylitol work properly. The best thing about it, too, with the Spry products is that there's so many to choose from. They have different flavors. They have all the full product line, toothpaste, mouthwash, chewing gum, little candy mints, even cough drops now with xylitol. And so it's a complete product line. You'll never get bored. You'll love the flavors. Everything tastes very good, and it is very effective.
And I just want to quickly mention, even though Peter hates it when I spell, it's Spry, S-P-R-Y. S as in Sam, Spry. And Dr. Peldyak, other than, other dental products out there not having xylitol in them, are there other reasons as to why we want to kind of steer away from some of these other products that we see heavily promoted on television with the people? Do you ever notice that all the ads have people with giant teeth that are promoting, they look like horse teeth, that are promoting dental products? Any reason why we're trying to avoid those?
Right. Some of the other commercial products, the big name products, they do have a little xylitol added, but it's mostly for window dressing. It's just because they realize that people will recognize xylitol as a beneficial ingredient, but they'll put it way down on their product list, so it's not going to be an effective amount of xylitol. The other problem is they have some very harsh chemicals in some of these products, and very interesting research came out of Northwestern University where they showed that using commercial mouthwashes can destroy beneficial bacteria, and that's what we want to avoid. We want to promote the healthful bacteria. We don't want to destroy everything. We just want to inhibit the harmful ones. So they found that commercial products with the very harsh chemicals could inhibit the nitrate reducers, which can inhibit the nitric oxide production, which is necessary to relax blood vessels, so your blood pressure can go up using harsh chemicals on your teeth. And another amazing thing is it could even destroy the gluten metabolizers. Part of the gluten metabolism takes place in the mouth and carries down into the stomach. If those bacteria are destroyed, and it was found that the xylitol does not inhibit any of these good bacteria. which is kind of a relief for those of us who have been using xylitol over the years. We wanted to make sure there was no problem with it. But on the other hand, you don't want to use those harsh chemicals in your oral care products because you will be destroying the good along with the bad.
I know a few years back we used to say 5 exposures to xylitol per day. Is that still kind of the guideline?
Good guideline. And where from was in the early 1970s when the research began. They thought that 3 servings a day would be fine, but people only ate 3 times a day back in the early 1970s. By now we're eating 6 times a day, and that's why we like to increase the number of exposures to xylitol. You're also being some of the dentally harmful foods, potentially damage. It's simple, really. You need to do it.
Oh, we're losing you, Dr. Peldyak. You keep drifting in and out here.
Sorry.
Where can people get the spry products?
At the natural food stores, and also be careful with Whole Foods, because Whole Foods is actually switching some of their mints to sugar mints, and you don't want that on your teeth. So call or talk to your local Whole Foods store and say, we want our xylitol mints. We don't want the sugar ones because that's not going to be helpful at all.
Now, one of the things I just want to throw out there that people have to be careful about as far as like having the mints or the gums is to make sure your dogs don't get into it because they don't metabolize xylitol appropriately. So just be careful. Don't leave them lying around. But other than that, it won't harm, people at all. And again, as you said, excellent for children and infants and preventing as they grow up, having good dental care. Is there any closing remarks you'd like to have for our listeners today?
Well, this is really so simple. It's so easy to use. A little bit of xylitol. It tastes good. You can use it because you're already using toothpaste and the other products. Just replace them with xylitol products. You'll love the way it tastes, and you'll love the way it helps your teeth and gums be healthy. And that's the big thing. We need simple strategies for difficult problems.
And again, I think, the spry products, because it is 100% xylitol. Again, there's some of the companies out there that are trying to glom on to, their success, but they add a bunch of other things to it, and that can be sometimes problematic. But we want to thank you so much for joining us today.
Oh, thank you very much. Appreciate the opportunity.
And we hope that we can talk to you again in the near future, okay?
For sure.
Thank you. You have a wonderful weekend. And again, if you're looking for more information about the spry products, you can go to xlear.com.